Dia a todos e todas. É com muito prazer que eu recebo todos vocês aqui, os que estão.
Good morning, everyone. It is a great pleasure to host all of you today. For our speakers who have kindly accepted our invitation, I have two announcements to make. We have translation from English, Portuguese, and Spanish. So at the bottom, there's a little button. Click on it if you need translation. So starting from now, you can click on the little globe at the bottom of the page, and any interaction that you want to engage in, do so using the chat function. There you can make comments, you can ask questions, whatever you need. And we have someone who's going to be reading the questions, and then we'll ask the speakers. I hope that we have a very fruitful morning. This is a very serious, important matter that we're going to address here today in this fourth webinar. In 2021, we had another 3 webinars, always addressing the alcohol subject matter, discussing important, relevant issues in relation to alcohol. And today we are bringing the global action plan put together by the WHO, and we're going to be able to discuss the plan a little bit with our speakers. I would like to remind everyone and have some items here for us to start thinking about the discussion, maybe provoking debate. I mean, alcohol consumption is something which is very much neglected by the public authorities and public policies, and it does not have a lot of impact as far as health policies are concerned. And this is very much aggravated by a lot of influence from the industry and its marketing strategies. They reinforce social norms that incentivize alcohol consumption. We know that there's leads to over 200 diseases and other injuries, such as heart disease, diabetes, cancers, as well as other problems such as traffic accidents, violence. And it also has a big impact on the mental health of people, increasing problems related to anxiety, depression, and this also has a big economic impact on social action. So we do indeed need to look at this problem and face it straight on. The vital strategies, Brazil and the Federal University of Pelopas, based on coordination and unanimity funding with funding from the Ipiranga Institute, did a telephone survey that we released very soon in April for risk factors for non-communicable diseases as far as the pandemic is concerned. And there we had a national sample for the big regions in Brazil. The results show a little bit of the magnitude of the risk factors, among them alcohol, and then we have some results in the pre-pandemic period, because we used to ask before the pandemic and then in the first quarter of 2022 for us to see the impact in this almost 2 years of pandemic. And we were able to see, based on the results from Brazil, that in the pre-pandemic period, we had alcohol consumption, which was 3 times or more per week of 9.3% of people. And this consumption has not changed until the first quarter of 2022, which in a certain way was a reason for celebration, because at least if it didn't increase, something important happened. However, when we looked at another indicator, which is the abusive sort of overconsumption of alcohol. For example, in the same occasion, women consume 4 doses and men 5 doses. We had alarming results. So 20.6%, at least a fifth of Brazilians reported, alcohol abuse a month before the survey. And this was asked only for the first quarter of 2022. So when we talk about frequent alcohol consumption, and alcohol abuse, this is more prevalent amongst men, which we knew already, but women has been showing sharp growth in recent years. At least this is what we've been seeing recently. And this is more concentrated in the younger part of the population, 18 to 24 years of age, reaching 25.8% of abusive consumption, 26.9%, 25 to 34 years of age. So this is a economically active part of the population. And the survey has also stated that consumption is very much related to level of education. So the higher the level of education, the higher the frequency of abusive consumption, okay, with people with over 12 years of education. And this was also considered when we talked about the work status. So people who continued to work during this period, so did not lose their jobs, we reach almost 30% of abusive consumption in the country's regions. The South and Southeast, they have a higher prevalence level. So as part of this scene is concerned, we need to implement some urgent actions, bringing together efforts from, public power, the third sector, government, universities, in relation to this, so that we can drive public policies aimed at reducing alcohol consumption. A lot of the times we have some conflicts of interest because of economic objectives and also public health, but we need really to defend public health, and this is a responsibility of having policies that does indeed face this problem straight on, with the goal of debating the alternatives to address this important public health issue. We are bringing to you this webinar with experts to talk about strategies based on the different global action plan for facing, harmful consumption of alcohol with targets until 2030. The adoption of this plan for WHO. This is the result of 3 years of work, and this brings the need to put together policies based on the safer package from WHO also. So now I give the floor to Paula John from ACT for her to be able to lead, help us moderate such an important panel that we're going to address here today, and so that she may help us to add knowledge working in favor of this important risk factor, which is still very much neglected. Thank you all very much for your attendance here today. I now give the floor to Paula Jones.
I will speak in English for the sake of the Spanish audience, the Spanish-speaking audience, because we have translation from English into Portuguese and into Spanish. So although I'm Brazilian, hello everyone, I'm Paula Jones, I'm the Director of ACT Health Promotion. It's a real pleasure to welcome you here for this panel. It will be more in the format of a conversation about the Global Action Plan. And here I have together with me Maristela Monteiro from PAHO, really historical partner in this challenge, that is a huge challenge. Luciana has already brought some of the figures about Brazil, about the size of this challenge in Brazil, and some of the lack of real action regarding alcohol control. We also have Maristela, it's from PAHO, based in Washington, D.C. We also have Øystein Bakke directly from Norway, and he's representing GAPA, the Global Alcohol Policy Alliance. Øystein also is a long-term partner, always following the global negotiations around the alcohol plan. And we also have Mike Dumbier, I hope I pronounce your surname correctly, from Movendi International. They're both our Scandinavian partners, really engaged in this, in the alcohol control discussions and global discussions and initiatives. So I want to start this conversation asking you some questions about the plan itself. First, I would like to ask a little bit about the history of the Global Alcohol Plan. The action plan, how was it designed, and Perhaps I'll start with Maristela, and then we go for the civil society perspective. Maristela, the word is yours.
Okay, thank you very much. And I also have to say I'm Brazilian, but I will speak in English for the sake of interpretation. And I think we need to go back a little bit before we talk about the Global Alcohol Action Plan, because the story more or less started in 2010 when WHO adopted the Global Alcohol Strategy for reducing the harmful use of alcohol. And it has several principles. It had 10 areas of action for country action. But when it came in 2019, almost 10 years after its implementation, the executive board of the World Health Organization, or the World Health Assembly, asked for an evaluation of the implementation of the strategy, given that not much progress has taken place. And so that triggered the first consultative process that included technical discussions in 2019, in June 2019, the WHO organized a forum on alcohol, drugs, and addictive behaviors. And then all regional offices of WHO organized consultations with member states, with the focal points appointed by the ministries of health on the progress they made and they've seen made in the implementation of the global strategy, as well as the barriers that were identified and why progress was not seen. The consultation was also web-based and included UN organizations, non-state actors, that includes the NGOs, but also consultations with economic operators that provide data to WHO on consumption of alcohol. And that led to a first assessment of the strategy. When that was presented, the decision made was to ask WHO, the Secretariat, to develop a global action plan for accelerating the implementation of the global strategy. So there was no question that the strategy was still relevant, but was not enough. And countries were not implementing the cost-effective initiatives and policies that we know work, and they were already reviewed and promoted in the context of non-communicable diseases, the other plan the WHO had. So that led to a 2-year process that was undertaken in several drafts of the plan. Each draft was consulted with member states, with non-state actors, UN organizations, and also a cross-border marketing report, given the developments that happened in the last 10 years, especially during COVID, on the marketing being across borders and in the internet or via satellite, that it was very difficult for countries to implement marketing controls that would be, because there was always a way to bypass them. So that led to the discussion. After 2 years, the final draft was presented within the context of the NCD framework. Again, other strategies were included in that, or related to the other risk factors. And in May this year, 2 months ago, it was adopted without any change at the World Health Assembly, which is quite an accomplishment, given that this is such a controversial and always debated and sensitive topic. So I'll stop there.
Thank you, Maristela. So we do have a reason to celebrate, despite like more than 10 years delay, I would say, right? I've been a bit there around around the negotiations of the Framework Convention on Tobacco Control, and I think that was one of the reasons why alcohol couldn't move forward. There was no like conditions or appetite and political appetite to move ahead with like two major issues as such. So I think alcohol has suffered a little bit from that as well. But I would like to move now to from a civil society perspective, having been there for a long time as well. I'll start with Oysten, if you want to give us like from your perspective, from GAPA's perspective, how has this process been like, and why do you think it's taking so long to move? Like, I mean, why don't we move ahead more faster?
Thank you, and thank you for the opportunity to participate in this panel and this interesting discussion. And Maristela, I think, gave a very comprehensive and good overview of the development of the action plan. And so what I would like to add are some perspectives from civil society. And one is your question about why did it take so long? I think one of the issues is, as you say, it's a very controversial issue. In WHO, there are very strong commercial interests involved. And finally, there are a lack of resources in both within the WHO setup to follow up on the alcohol issue, but also in the wider context among civil society and member states' allocation of resources to address alcohol harm. And one of the aspects that I think is interesting to note is that when the global strategy was passed in 2010, it was the result of a process that had lasted for 5 years after a big lull in WHO, where alcohol was not addressed at all between 1983 and 2005. And then the strategy came in 2010 as a standalone document on alcohol. Later, the NCD process included alcohol as one of the risk factors for NCDs. So in a way, you had two tracks. One was alcohol per se as a separate track. The other thing was alcohol as a risk factor for NCDs. And it's interesting to note that when the global action plan was passed, it was passed under the heading of the wider NCD issues. And that is significant in some ways, but I think it's important to remind about how alcohol is not only a risk factor for NCD, but has a wider public health and social aspects and harm related to it that could be involved in that. So that's one of the issues that I think is worth noting in this regard.
Thank you, Oysten. Now I'll move to Mike, because you also mentioned like the commercial interest, and I think Mike is the person to talk about it. And I mean, if you can just quickly introduce Movendi before I will.
Thanks, Paula. Let me just say that I am born and raised in Germany, so not Scandinavian. Of course, now I live in Stockholm, but I think it's important to underline that we are many different people from different parts of the world. Unfortunately, I don't speak Portuguese, but I think with Brazil, we have the language of football in common, the Germans and the Brazilians. And I think what I can add to Maristela's story of how this came to pass now, a few clear words. We look at a lost decade in alcohol policy from 2010 to 2022. So more than 10 years where there is no policy progress, as Maristela has said. So low and middle income countries have not invested more in alcohol policy development. And there is actually a wrong progress or progress in the wrong direction when it comes to alcohol harm. So alcohol's contribution to the global burden of disease is actually increasing in comparison to other global burden of disease risk factors. And thirdly, alcohol policy has not been on the agenda of the WHO governing bodies. Øystein mentioned this a little bit, but I think it's important to be very clear that we adopted the global alcohol strategy in 2010, and for the last 10 years, we had no review mechanism. So the global community was actually never gathering and asking themselves, maybe after 3 years or after 5 years of the global alcohol strategy, how is it going? And so I think it's important here to say that yes, alcohol industry interference is a big obstacle, but I think we also look at the reality where the ambition for alcohol policy in the World Health Organization and from member states has been too low. Alcohol policy has been missing in important global health topics, women's health, adolescents' health, road safety. Øystein mentioned that alcohol is not just an NCD risk factor. HIV/AIDS, wherever we were looking, alcohol was not present, and that needed to be changed. So we used all these other agendas in the global health discussion to actually create attention for alcohol policy. And then that was not, a natural phenomenon. That is work that we did in 2018 to bring back alcohol policy as part of the NCD agenda item and put it back on the World Health Organization agenda. So that has to be said there, that there is advocacy work behind the scenes. Movandi International is working together with governments to actually put the issue back. And so that tells you a little bit about Movandi International. We are a global social movement. So we are 137 member organizations in more than 50 countries. And just in the last year, we talked with more than 50 countries to get this global alcohol action plan adopted. And that means we work with our member organizations in the capitals and then in Geneva. And now I'm in New York. We also do this work here in New York. And that work is so important to overcome alcohol industry interference. So once you create platforms for the alcohol policy champion countries, you also manage to isolate the countries that do the dirty work for the alcohol industry. And that is what we have been able to do, I think, in the last 2-3 years. In the Americas region, there are some countries that I think everybody knows well that are prone to do the dirty work for the alcohol industry. But if we bring together countries that champion alcohol policy, that want to protect their citizens from the harm caused by the alcohol industry, we, I think, minimize, we don't eliminate, but we minimize the interference of the alcohol industry through some of the friendly countries. And that is what we have been working with there. And I, as we can see, in that sense, we have been successful as the action plan was adopted, as Maristella said. So I hope, Paula, that answers the bigger question, gives a little bit of insight in how we have been working against industry interference and who we are in Movandi International.
Thank you to you and Øystein. We'll have more questions, but I'll give over to Maristella. You're on mute, Maristella.
Yes, I just want to complement what was said, and that on the other hand, I don't consider that these 10 years were a total waste. If we think back in 2005, when countries were questioning why is alcohol an issue, when developing countries, low-income countries were asking, this is a problem of high income and not for us. So it was a wake-up call for the work that needed to be done. No link with development at all. So when the strategy was adopted was the first time that, convincing member states without much data on those links, actually, to bet on it, to do. But it fell short, I must agree, because it did not have indicators. There was no accountability. The indicator or 10% reduction on harmful use of alcohol was in the context of NCDs and not the strategy per se. So what it adds on right now is, I think, most of all, accountability, need to report, monitor what's happening, but also it made very clear that it must, everyone, protect the public health interests above commercial interests, prevent commercial interests from undermining the public policies. And I think that will give us a way forward that is more clear, and with the help of NGOs and regional offices, etc., we maybe will succeed this time.
Thank you, Maristela Ois, and I see you have your hands raised as well.
Yes, thank you. I also wanted to just add a few words to what Maristela was saying there about the lost decade, because I agree with Mike that in many ways it was a lost decade. But when you look at the situation in 2005 to 2010 and compare it to the situation today, there is an indication that there has been quite a bit of development. And Maristela, you pointed to some of the important parts of that. And I think that many low and middle income countries are realizing that they are the emerging markets of the alcohol industry, that alcohol consumption and alcohol harm is increasing in their countries, and that they are being targeted, is an important background to the interest and the engagement from these countries in bringing forward the global action plan. And it's interesting to see that even if there were several European countries who were championing this action plan, there was great support, and many countries from low and middle income countries who were initiating the process that started this whole thing. The review of the 10 years of the global strategy was initiated by Thailand, pushing it through the Health Assembly and getting the commitment for the involvement of member states, and not only a report from WHO, which was originally some people were thinking about. So that was important aspects that lies behind this, I think.
Mike, you want to comment on that as well? Go ahead.
Yes, I think it's important to say two things. When we speak about lost decade, we are doing two things. We are framing the situation when it comes to the harm caused by the alcohol industry in the world. And I think that is one important thing where the whole alcohol policy community has been too weak in the last 10 years. So actually also to say what is going on in less academic and more of a way that actually people can understand. And then secondly, we can of course substantiate. So for example, if you look at the global alcohol strategy was adopted in 2010. And since 2010, the World Health Organization has actually not issued technical tools for the governments to implement the different areas that Maristela mentioned, these 10 action areas. So that's why we see there is a lost decade, because the WHO has not been working with this to the degree that WHO needed to work. And that brings me also to an important point here. The regions really matter as engines for global progress. I think the PAHO, the Southeast Asian region, so PAHO is Americas, of course, Maristela, the Southeast Asian region, and the European region, they have taken up some of the things that the headquarters at the global level have dropped, where they dropped the ball, so to say. Maristela, I think you guys issued technical briefing on marketing and on taxation. Very important to empower member states, governments to actually take up alcohol policy and to show, we have this discussion also in the chat, the return on investment, the potential of alcohol policy. So I think that we can see here how the regions have filled some of the gaps that were left at the global level to at least build this kind of momentum or use the momentum from the global alcohol strategy. And then Maristela, correct, also now we have new momentum. Now we have a better position, better infrastructure. And I think we can talk more about this as well.
Thank you, Mike. I think it's a fascinating debate because there are so many elements in the history of this. I would agree with the need to talk about a sense of urgency as a public health issue. I think we all agree here on that, right? That well, we need to act on that, and alcohol has been a neglected issue. And when we think about like the commercial interference of the industry interests around alcohol, first the opening of new markets in developing countries and so on, it's the same old story, it's the same playbook as we have seen so many times, like basically like copy and paste in the tobacco industry tactics. And I think we are more mature as a global health community to be able to act more effectively around alcohol control issues. So I have a question. I mean, one, it's like more, it's a bit talking about the industry again, because like we do have clear guidelines about interactions with tobacco industry, and WHO has clear guidelines about interactions with like the arms industry, and we do not have like similar guidelines for the alcohol industry. So I'd like to hear whoever wants to comment on that, and what does it mean in terms of like being able to move with the implementation of the plan, as we know that the alcohol industry lobby, it's one of like the obstacles, like in really being effective with like, for example, marketing restrictions and increased taxation, and like the best buys, the most effective policies. So who wants to start? Mike?
Thanks, Paula. I can start if that's okay. I think maybe I can say there are many things to say. Maybe I can say two things. I think it's important to recognize that WHO's approach to the alcohol industry, and I mean headquarters, and the Global Alcohol Action Plan itself are schizophrenic. So WHO tries to eat the cake and have it at the same time. They try to keep a firewall to the alcohol industry, and the framework for engagement with non-state actors, the FENSA, is supposed to help. But in our opinion, in our assessment, WHO is now blurring the lines, and we think the WHO is violating the FENSA. So WHO, for example, engages annually in a dialogue with the alcohol industry, and for us that is completely wrong. The WHO should not normalize these major alcohol corporations that cause so much harm, and that actually lobby against all the best buys that the WHO is recommending member states to adopt. So the WHO dialogue is there that actually normalizes the alcohol industry, and then the action plan itself gives the alcohol industry a role in all 6 areas. WHO tries to make there a little difference, calling these measures, and also writing about what the alcohol industry is not supposed to do, but this will be exploited by the alcohol industry. They already exploited the global alcohol strategy, giving themselves a role in the implementation of the global alcohol strategy. So here we can see that we need a clearer stance from WHO. We need a guiding document, and member states have called for this now the last half year in the governing bodies. And that is one of the things that has not been developed in the last 10 years. So I think civil society member states are requesting a much clearer stance, much stronger protective guidance from WHO for member states. But we can see that there are some problems, inherent problems in how WHO is addressing the alcohol industry. Thanks, Paula.
You're welcome, man. And I think that's very much a question for civil society. We do have a role to play with that regard, right? You want to say something, or I think?
Yes, thank you. I can only underline what Mike's already pointed out. And I think that it's interesting to see that when WHO developed this framework for interaction with non-state actors, the FENSA framework, at one point during the discussion, it was proposed by some member states that alcohol industry should be included among the sectors which WHO should not engage with at all. But that did not come true. Some member states objected to that, and through the negotiation, the alcohol industry was kind of included in the list together with other harmful products industries, particularly related to NCDs that should be treated with special care. And what Mike says about the schizophrenia or WHO here is this difficulty of handling this with special care at the same time as they have these interactions. And that also goes through the action plan itself, because if you read the language of the action plan and the introductory language, it's quite strong on how it's talking about engaging with industry. It's quite pointing out how the alcohol industry is a big part of the problem. But when it comes to the action points, they have included action points for the industry at each and every action area, the 6 action areas included in the action plan. And the wording of them are very strange, because mostly it says what the alcohol industry shall not do. And then it has some openings for actions that the alcohol industry is encouraged to do. And together with what Mike points out about the annual meetings that WHO have with the industry, at the same time as they're warning about their bad effects, they're legitimizing their role in public health. So I think it's very important that we as civil society underline the critical language in the action plan and all the recommendations that the industry should not engage in various activities and bring this forward, because the alcohol industry will of course do the opposite and try to point out how they have been included in the action plan.
Well,
Mike, Maristela, I wanna
I
put on the spot on that one. I mean,
yes, I feel poked here, because I am, after all, also a WHO staff. So, but I am not gonna talk about the plan, but what we in the region have tried to do over the years, and why. So, while FENSA exists, and we have a legal team that analyzes requests for dialogues, interviews, engagement, we did not find a single opportunity in the last 10 years to do so. So from the regional office, I came to listen to the dialogues with the industry, but that was about it. And the second thing that we did was, given that apparent need to get data that the industry has on alcohol sales production, we developed with a collaborating center a tool for countries to do that themselves, because the countries have the data. They don't know they have the data. They don't know where to get the data, but it's there. And it has to be there in 99% of the countries. So there is a tool, the alcohol per capita consumption tool, estimation tool, and is the same one that WHO uses to conduct estimates for every country. So we get teams together, we offer that. There is now a course, a virtual course for self-learning, but we promote that the countries can do the course and then contact us if they have any questions, and we review what they do. They can do their own assessment, and then we ask to validate that, to see if they missed anything, if it is compatible. And so far, we had good talks, and now countries such as Brazil have the data that they can report themselves. And we found much higher, for example, per capita consumption that was being reported. In Mexico, it was double counting of unrecorded alcohol consumption that they were unaware. We have Uruguay regularly used and send their own data. And we're open. Costa Rica also uses the tool and has been reporting every year to us and to WHO. So there are ways around, and we hope that more countries can use the tool. The course is available to any country in the world, and it is in 3 languages. And so that's our contribution to limit that capacity of engagement with the economic operators. And we're planning for next year, maybe, or later in the year, to have a brief and fact sheets on interaction with the economic operators, and or how to protect, actually is in the frame of how to protect public health. This is a need the countries have raised indeed, and we're working on it. We know WHO has been working on it, but we didn't see yet the results. Thanks.
Thank you, Maristela. I'll give over to Mike. I think it's excellent. I'll give over to you, Mike, to whatever comment you have to do before, but already asking you to comment on, I think Maristela brought a very important element. One, it's about that the different actors here around the table have a different role to play. And that seems, I mean, this is a very important one. And then like moving from like the need to have this information, this data as like a basis to be able to move forward in policies. I would like you also to start commenting on what are the policy opportunities that we have that you see are the most promising ones, like given like the challenge we have, understanding the broader scenario, but let's try to move now to look into the policy opportunities that we might have.
Thanks, Paula. I think what Maristela is explaining here is a fantastic example for how regional WHO work can benefit countries all around the world. That is what I alluded to before, where there is leadership from the regions addressing some of these challenges that have been identified over the last 10 years, where global action has been lacking, but where regional action really has picked up the ball and I think provided much needed momentum and assistance. And in this context, I wanted to pick up one other point that Maristela made, I think in her introductory remarks. Alcohol is one of the biggest obstacles to sustainable development, but is not really addressed there. So we are here in New York to participate in the high-level political forum on sustainable development. And what the alcohol industry is doing, they are utilizing other policy areas, road safety, and sustainable development. So they are engaging in greenwashing and whitewashing and pinkwashing. And in these areas, our job is also to mainstream alcohol policy, counteract the alcohol industry, and increase the level of understanding how much alcohol policy is a catalyst for gender equality, for sustainable development, for road safety, and so on, so that the alcohol industry doesn't have open avenues in these other policy areas. And so I think that is something that Maristela alluded to, where we have our work cut out for us. Paula, and I think that brings me then to your question, policy opportunities. Again, there is much to say, but I would highlight 2 things. Oystein mentioned lack of resources, and what I cannot understand is why we have, if it's true that we are lacking resources, and I agree that it's true, why the conversation about alcohol taxation has been absent for so many years. So alcohol taxation is the single most cost-effective alcohol policy intervention. The return on investment from alcohol taxation is massive. And so with alcohol taxation, governments get to reinvest into health services, maybe even into community action, all those things that the global alcohol strategy says. And I think advocacy has been lacking for this. I think that there is now a policy opportunity to address fiscal space. Governments need money because of the coronavirus crisis. I think also the Russian war against Ukraine is further shrinking fiscal space, and alcohol policy really can help reduce the harm, reduce the costs from the harm caused by the alcohol industry, but also yield returns on investment. So we would like to see, for example, in the Americas region, an interagency initiative that brings countries together with the World Bank, with PAHO, with the OECD, if possible, to advance alcohol taxation. And that brings me to my second point, infrastructure. If we bring the policy champions together, those countries that want to do something, they will learn from each other, they will support each other, they will feel like this is important for others. And that is why we got the Global Alcohol Action Plan, supporting and making sure that these champions discuss with each other and support each other. So I think technical assistance, building infrastructure, plus alcohol taxation, these are two massive opportunities to move forward, Paula.
Thank you, Mike. Maristela?
I can add, yeah, I can add to that we can't forget the WHO initiative SAFER, which was also led package to try to promote the most cost-effective initiatives or policies, and it was launched in 2018. So I think that is still based in the global strategy, but gives it seems more doable to come with clear policy messages, and that includes taxation, of course, that countries can do this. There is evidence that they work, they are compatible with the Appendix 3, etc. But I must emphasize that the need to build capacity at country level is tremendous. And it is hard to see that from the outside. When you work with a middle-income country, there might be one person in our region is better than other regions, to say the least. But you go to a country office and the person in charge of alcohol-related topics is in charge of 10 other topics. And that's the same full-time person that needs to dedicate at most 1/10 of their time for alcohol. So this makes it very difficult. And that is the person that will contact the Ministry of Health, other ministries, organize meetings, and so on. So the resources are needed to build capacity within ministries of health, and in our region there is a tradition to work with PAHO as well, so that capacity inside the organization is needed and requires resources. I also think that an important component is the advocacy per se. The campaigns are needed to change the public discourse. We have a culture of millennia around alcohol is good for you, and it doesn't change over time. From one day to another, recognizing that alcohol is actually bad for you. And so even though per se, it will not change consumption immediately, but it will create better conditions for the work that we all want to do, is in the same direction. But the public needs to support us. At the end, are the politicians who will vote on these new laws, and they are backed up by people who vote on them. Thanks.
There is a question here. I think Maristela has already answered part of it. Capacity building, advocacy, what steps, the question in the chat from Angelica Claro, what steps you recommend to make the governments in our countries in Latin America to adopt and implement the Global Action Plan? Do you want to add anything to that?
Well, what you said that what we plan so far in the region is to have a consultation now on what countries are ready to do and will commit to do by 2030. Those indicators of the plan are global indicators, but now let's go down to the region, each country, and see what are the baseline and what are the goals, and that will give us, it's like a thermometer of the commitment, and we will see which countries are more committed or not to do what needs to be done. There must be a commitment to implement the best buys or the most cost-effective policies. And we'll seek support to work with countries to move that agenda. And that includes the NGOs, the research, the data. I think we have substantial data, but there is also efforts on with other units in PAHO, other organizations on the return on investment, for example, on showing the economic returns by investing on taxation or the other policies as well. I'll stop there.
Øystein?
Yeah, can I add to that conversation we've had here about what is effective and what should governments do? Because picking up on Maristella's last point here about changing the narrative and changing the perception of, you know, alcohol being a good for you, good for the heart story and all of that, which has been played for so many years, towards an understanding that there is no safe level for alcohol. And part of that discourse is, of course, the alcohol industry's focus on individual responsibility, trying to make alcohol an individual question, while the action plan and the evidence show that there is a strong correlation between the total consumption in a society and in a country and the level of harm. So reducing the total consumption in a country will contribute to reducing the levels of harm there also. And it's not only about trying to appeal to individual responsibility, but look at what are the effective evidence-based measures that can be reduced. It can be used to reduce harm. And Mike spoke strongly about taxation, which is certainly an important part of that. That's one of the 3 best buys. So I don't need to say more about taxation, but also add that there is a strong evidence base for doing something with the pervasive marketing on alcohol. It's all over all the time in most countries, and it needs to be reduced or preferably eliminated. And then there's the availability question. When alcohol is available all the time for everyone, 24/7, that increases the consumption, and making alcohol less available is another of those best buys that are included in the SAFER package, the SAFER initiative, which draws on the best buys and also add other issues related to traffic. Removing alcohol from the traffic is a good way of reducing harm, and also offering screening and brief intervention for people with who are in the area of developing alcohol related problems. So so these issues are there in the action plan, and we need to make use of them in all countries.
Thank you, Øystein. Mike, you want to comment on that?
Yeah, I really like the question about next steps and your question about policy opportunities. So I already gave my view on what the biggest opportunity is. We also in Movendi like to discuss it community-based or in the regional or in the country context. And I think in the Americas region and in Brazil specifically, opportunities are alcohol's role in violence and alcohol's role in water insecurity, food insecurity, and environmental degradation, things that really matters across the Americas region. And I think these are emerging policy opportunities that can be addressed. So Øystein, he summarized the SAFER package, but I think we need to identify these policy opportunities and then explains, so how does a marketing advertising ban help protect women from alcohol violence? How does a reduction in alcohol availability help to secure drinking water in Brazil and in the Americas region? I think there we have these policy opportunities, and I'm very happy to hear that Maristela is preparing this kind of consultation with member states. And to answer this question also there from Juliana, I think for the next steps, what I would hope for in the Americas region is this kind of infrastructure that allows governments to learn from each other. So we were just in Geneva for the World Health Assembly as an example, and we arranged a side events with government representatives from Europe, Southeast Asia, the Americas, and Africa. And afterwards, we sat with one government, and they were so amazed to hear about the success stories from completely different governments, from completely different regions. They didn't know, and I think Maristela explained it already. The technical people, they don't have, I think, the capacity and the time to follow all the developments, read all the reports. So we need to come in here, but now they want to meet. They want to have an exchange with this other government. They want to figure out, so what is it that they did? And so I think if we do this, and I think that should be one of the next steps in each region, bringing the governments together that have done something, facilitate lessons being learned, and I think facilitate adoption of some of these policies. Thanks, Paula.
Thank you. I'll give over to Maristela to answer one of the open questions in the chat, which she already read.
Yeah, Angelica was asking about this consultation process, and if the report will always become available, and we put in the website when we do that. So for sure, this will become available. And in terms of what was a big accomplishment in this 10 years, I would say we don't have one country that has implemented and changed dramatically, but we have many good stories, and including the ones in Brazil on traffic safety, that we know it is also dependent on continuing to enforce the laws, but the changes led several other countries to adopt the same zero tolerance for drink driving. We have Costa Rica that has relatively strict restrictions on marketing and continue to fight against the reversal of those changes that continuously come from the industry. Chile has mainstream and really widely adopted brief interventions in primary care and trained professionals in the first level of care to screen and provide interventions. And while we are developing tools, digital tools that may be helpful, but I would say that what we've seen in these 10 years in terms of action from the NGO sectors, how it has grown, is for me an accomplishment, as well as research. There were over 50 studies done by countries on alcohol policy, on the elasticity of prices, for example, demand for alcohol, and policies to restrict the hours of sale. They are local, they're not global, but that is the same everywhere. There are certain measures you adopt and you implement at local level. And when you do and document, you can show that, that things get better. And we have cities all over the region that have limited access to alcohol with great success. So there is a lot to do, but I think we got a momentum that we shouldn't miss, and we need to expand now. So it keeps in the minds of everyone every day that something needs to be done.
Thank you, Maristela. I will make a comment now because of some of the questions there in the chat. I mean, there is one, I mean, in terms of the next steps, I think you covered that very well. I really coming from a civil society organization, I will come from also from the civil society perspective. I think we have also an important role to play in making the case and advocating for this policy change and advocating for this change in the narrative, because I mean, there is no other way around, because we know like the economic power of the alcohol industry, particularly in Brazil. We are talking about the home of the biggest, right, brewery. I mean, that's already all over the world. It's Brazilian, it's hosted in Brazil, which should not stop us from doing anything. I mean, we had the exactly same situation in the case of tobacco. We had like the biggest like tobacco grower in the world, like located in Brazil. So I think that should not stop civil society organizations from like making the case for the need for alcohol policy. I think we are more mature, and I don't think, and governments are often like too influenced by the industry lobby. We all know that, and that lobby does not stop at the national level. I mean, it goes all the way up to the global level. We know that, so I think it's our role we have an important role to play that. There was one comment here from Ricardo about like the government decided to attack cigarette, but the story, it's not because the government realized that the income didn't cover the revenue, doesn't come for the cost. I mean, it was a long-term work of like in bringing up this narrative. And in the case of beer in Brazil, the taxation, it's negative, really, because they receive many incentives because the way that they organize, they benefit from the tax shelter in the Amazon region. So the beer industry receives lots of incentives in Brazil that obviously needs to stop. But I think we have an important role as civil society, I mean, organizations and whoever comes is aware of this information to help, like to make the case for happening with alcohol the same that has happened with cigarettes, right? And it's an ongoing work. It's not overnight. It will take a while, but that's one of the purpose of having these conversations, right? And it's really good. I agree that there is a global momentum now, different than we had a few years ago. And the action plan, it's a very important tool that we must use. And I'll give over to Oysten. You have your...
Thank you. Yes, I wanted to add to that, because I think that's one of the encouraging developments that we see these days, is the increase in engagement from civil society around alcohol issues, and including from Latin America, which is really, really encouraging. And makes me remember that when we met Latin American non-state actors, so-called, around the World Health Assembly, when the not the action plan, the global strategy was negotiated in from 2008 to 2010. Those were representatives of the beer industry, coming from Latin America to lobby around the strategy. Now we see civil society representatives, and we see an increasing engagement from civil society all over the world around alcohol issues, and that's really an encouraging development. So I just wanted to add that.
Thank you. Well, as far as I can see, I think the questions there in the chat are okay, unless any of the people who ask wants more clarification, please feel free to do it in the chat. I have one kind of last question, because we will have like 10 minutes left and we'll need to round up very soon. That's more a kind of a specific question, because I mean, we know that, I mean, with all the data on total consumption now, we know that excessive, and Luciana brought in the beginning the data from Brazil about excessive consumption among certain groups and among certain, I mean, about women, like the consumption is increasing. I mean, just I would like to hear from you, like, because we have like the global policies that we know, taxation, marketing, that will impact the population as a whole. But what can we do in terms of having like some specific policies to deal with like this excessive consumption in some jurisdictions? What experience you would like to share around that area, because I think we have like global and like national and local and community level actions. So whatever you want to share about that.
So maybe I can jump forward. It's a tricky question you're asking, because we know that the policies that we have been discussing are effective in reducing total consumption and total harm. But they are also effective in reducing so-called excessive consumption. But what is excessive consumption? There are different aspects of that. Very often it's called heavy episodic drinking, particularly when you talk about young people. That's one of the concerns, and that's what we see in the interventions from many of the Latin American countries in the discussion of the Global Action Plan, was this concern about excessive consumption or heavy episodic drinking among young people. And one of the aspects of that is that is an important part of the profits for the alcohol industry. When they say that alcohol should be an individual responsibility issue, and that we should leave it to the individual to regulate themselves, and for the industry to regulate their own marketing, etc., etc. What they're not telling is that it's the heavy consumers, those who drink a lot over a long time, and alcohol being consumed in heavy episodic drinking occasions, that is making up a majority of their sales and therefore also their profits. So regulating the market and using the best buy policies are also part of the answer to your question, but it's not the whole part of it.
Excellent, thank you. And I think that's an important point. And again, to reinforce, to reiterate the need to separate individual behavior from policies that will impact at the populational level. And I think regarding the narrative, that we need to change the narrative about alcohol consumption, that's a very key point, because I think that's the major argument that the industry uses to say that they are a part of the solution and that they are doing whatever they can to stop with the excessive consumption. So it was a provocative question as well. And also because I think the definition about that has changed slightly. And even thinking about the Heart Association, they have recently changed their position. So I think there had been some movement around this concept of, okay, drinking a little bit, it's okay. It's only if you drink too much that it's not okay. So please, Maristela and Mike, on that.
I just wanted to, first say that the Global Action Plan is clear on that most of the sales of the alcohol drunk is drunk in heavy episodic occasions or heavy drinkers. So that's why we have such a conflict of interest with the commercial enterprises or economic operators. But I also want to address, there was a comment here on the chat that unlike tobacco, that one cigarette a day can be a problem. One bottle of beer a day, it wouldn't cause so much harm. That is so wrong that I must address it here. And first, because a bottle of beer, if it is the bottle of beer of Brazil, it is between 3 to 4 drinks in one bottle. And that every day is certainly close to you becoming dependent on alcohol. If you do, at least you're going to be certainly a heavy drinker. And drinking guidelines that are used for, in some countries, Brazil doesn't have that, but Canada, for example, they have been reviewed recently. And what they suggest is that the people should drink 1 drink per week. It would be a low risk drinking. And that gives people a perspective of drinking every day is not recommended at all, even if it is one drink per day, and it can be any drinking is not recommended. It's different if you are ready with your provider, health provider, and you are a drinker, that person can advise you, the professional, based on your other risks, your situation, your age, etc. If that your level of drinking should be reduced or maintained. But that is very different from recommending someone to drink to improve their health. Alcohol does not improve the health of anyone. So if you are not a drinker, nobody in WHO in particular will never recommend you to start drinking to improve your health. And that is what people don't realize, together with the fact that most people do not drink actually. More than 50% of the world's population does not drink at all. So we are in a dreamland that was created by the alcohol industry, and we need to get out of that, wake up, and look around us. And there are other ways to have fun and to learn, to do whatever without alcohol. Thanks.
Go ahead, Mike.
Thanks, Paula. This is a great question. I appreciate a provocative question. It's like this: alcohol harm. In Movendi, we speak about the harm caused by the products and practices of the alcohol industry is pervasive. I think we all know it. We know people, we know contexts, we know it. We see it in the social fabric of our communities and societies. And now we have to imagine that everybody has an understanding of where the harm comes from, who is, so to say, to blame, who's responsible for the harm, and which solutions work and don't work. So I think Maristella just responded perfectly to which solutions work and don't work. And that this recognition is so important, because what we say about alcohol harm and where alcohol harm comes from either helps alcohol policy or it helps the alcohol industry. So when we say things like harmful use of alcohol or excessive use of alcohol, we actually help the alcohol industry. We help the alcohol industry to maintain myths. Oystein mentioned this before, to individualize the problem and to create the idea that there is some alcohol consumption that is not problematic, and then there is other alcohol consumption that we don't need to care about. And now if you think about excessive alcohol consumption, what does it mean? If a person drinks 2 glasses of beer, is this excessive? But if that person gets into a car and kills 3 other people, now we have severe alcohol harm, but as society, we have not identified this consumption as excessive. And so I can go through with this. I think there are so many examples, again, violence against women, or how children grow up in homes affected by alcohol harm. Is this excessive? What are the images that people get if we say excessive alcohol consumption? And so in Movendi International, we recommend that we don't use this language because it helps the alcohol industry and it misportrays where the harm comes from and who is responsible for the harm. And so I think the last point here is actually to say most of the harm that is so devastating when it comes to the economy, to our health system, comes from the so-called regular users, not from those that are consuming in the most heavy amounts. And that is because so many people consume alcohol. So they don't show up to work or they don't perform properly at work. And so we have productivity losses. And so if we talk about excessive consumption, we don't actually look at this reality where most of the harm comes from, where most of the costs come from, and that we can actually do something about the population level harm, so to say. And so, yeah, my plea would be, please don't use these terms. They help the alcohol industry and they don't help us advancing these evidence-based policy solutions that we discussed today. Thanks.
Thank you, Mike. I think we are about like to end this part of the debate, but I would like to hear if like you want to say like one last sentence or word like to bring us all together and to engage like the audience here to be like partners in the implementation of the Global Action Plan. If you have a last message for to all of us, Maristela.
I would say we are all part of the solution, and we need to work together, support each other, and not give up.
Oystein?
Thank you. I would say something like alcohol harm can be reduced, and let's join together to build a momentum to do just that.
Thank you. Mike, your last sentence.
Thanks, Paula. I think to make a difference for communities and people affected by the products and practices of the alcohol industry, we need bigger ambition, and we need to dare to imagine that alcohol is not normal, like Maristela alluded to before. So bigger ambition in what we take on, and challenging our thinking about the role alcohol plays in our communities, in our societies. That will put us on track to protect more people from the harm caused by the alcohol industry.
Thank you. Well, thank you, the three of you. I think it was an excellent debate, and it's really always a pleasure to have this conversation with you when you have been on the forefront of that agenda for such a long time. And as a public health activist as well, I mean, really, I thank you that people like you and all of us here that in terms of like, we need that to advance the agenda. I will give it over to Diogo Alves from the Brazilian PAHO, the PAHO office in Brazil, to wrap up. And thank you once again for being here and also for our audience. Diogo.
Obrigado, Paula, e também obrigado
Thank you, Paula, and thank you to our speakers, Oystein, Maristela, and Mike, for this incredibly enlightening debate in such a precise moment, at least for our national reality. Luciana, in her words, talked about the impact and the magnitude of this problem, which is not just a public health problem, but affects the whole development of Brazil and other countries similar to Brazil. And in recent years, as it has been mentioned, this sort of overview of the WHO global strategy in the last 10 years, everything that has been said may be applied to the national reality, how we move forward, how we apply the devices, the 10 strategic sort of pillars of this global strategy. And we've come to an impasse, which means that, not much has been achieved. If we look at the last 30 years, alcohol goes from 10th risk factor for death here in Brazil, reaching the 7th position as far as risk factors for death in Brazil. So this gives you a sort of an idea of whether or not the strategy is being met in Brazil, despite having regulatory frameworks in line with these strategies. It seems that compliance with these frameworks is still a challenge for national authorities and society as a whole. And I'm going to start by the end of these last messages that were very optimistic, messages from our speakers, because I want to discuss where we want to arrive at. I think that Mike has brought a very strategic view, which is this sort of normalization. So colleagues talked about the issue of tobacco that in Brazil, in the last 30 years, was the denormalizing of smoking. And this, at the time when it was kind of presented, this was very controversial in the country. And I believe that if we have a view of where we want to arrive, that would be the denormalizing once more through these 10 proposals that the strategy brings to us, and another instruments that have big frameworks, such as, alcohol in the 2030 agenda. Its inclusion is already a big milestone. We have the best practices of WHO and in Brazil Fortunately, we have regulatory frameworks that allow us to do this, such as the new drug policy, where 3 of our best buys for alcohol are there. We have the new Dutch plan from the Ministry of Health, where we have clear indicators and action options for alcohol. And once more, I am going to be optimistic in relation to this, but the report understands as a high impact in sustainable development. This may be seen in a very sort of thrilling way, because if we work effectively, as Maristella mentioned, if we effectively work together to face this challenge, as far as public policy is concerned, this public policy challenge, this means that we would, in a way or another, speed up the Agenda 2030 compliance. And this was presented at the sort of municipal, the local levels, and most local governments, they are committed to the 2030 agenda. So we would have a great opportunity to work together. So you who are here on behalf of civil society are paramount partners to be able to help us in these challenges, our government partners, to create this sort of synergy, this leadership in facing, controlling this public policy challenge. And we also have challenges. So in a certain moment, we have the issue of elections in Brazil. This means that we have the possibility of renewing our National Congress, new politicians with new ideas, open to dialogue, open to new proposals. And most activities, interventions, actions proposed in our strategy, the recently approved strategy, goes through legislation without a doubt. So we have an opportunity of bringing, as a society as a whole, bringing to this new Congress options to implement the strategy through legislation. So I see this as very positive. We have been presented with many challenges, these challenges that have presented themselves in the last 10 years, but here, based on the final messages that you've brought to us, I bring some very positive points for us to work on, and we will rely on all of you to support us, to bring us the best global practices, global evidence, and how we would put this into practice on our side of things. We would take it out, roll it out onto the field, and how we could apply it in all its levels in Brazil. So I'd like to thank ACT, Vitalist Strategies, for organizing this webinar for us. And then I also for inviting me to, make the final comments. Thank you very much for the invitation. And once more, I would like to say that, you can count on our organization. We are big partners, and thank you for us to be able to work on these different issues. And then I give the floor back to Paula, who will finish up for us. Thank you, Diego. I think I'm going to send it back to Luciana for the official conclusion, and thank all of you once more for your attendance. Now, I just like to thank you all for being here, and we can see big challenges ahead and a coherent society that comes together to do public policies based on evidence. We are going to arrive at good terms and definitely sensitize society vis-a-vis this serious public health problem. So I invite you to continue to follow what we are going to do. Further down the line, we're going to hold some other webinars on important issues such as this, and then we'll send out invites and get in touch as much as we can. And I'd like to thank all of you for being here. We are going to make the recording of this webinar available, and then thank all of you for being here. Wishing everyone a great end of day. Thank you. Thank you all very much.
Uma salva de palmas coletiva. E novidades em breve, esperemos, seguir aí nessa agenda.
We are going to continue to work on this agenda. If I have any new things, we shall let everybody know. So yes, we have a lot of work ahead. Thank you very much and looking forward to it. See you all later.